opioid abuse continues to be a huge problem in the United States, meaning that painkillers continue to be overprescribed and people continue to be extremely addicted to them. Well, a new poll, or I should say survey, that talked to employers found that many of them are experiencing issues with painkillers at the workplace. Let me give you the numbers. A December survey conducted by the National Safety Council found that 80% of employers in Indiana say they've observed an issue with painkillers among their employees, and a whopping 60% say they've observed some kind of issue with the use of prescription painkillers at work. Now, keep in mind that no one drug tests for painkillers. I mean, there are very few companies in the U.S. that do. I don't even think that drug testing is really the right way to combat this issue. But a lot of companies certainly drug test for things like marijuana. And marijuana stays in your system longer. It's certainly not as addictive as opioids are, although some people do have a dependency to it. It's not a chemical addiction. It's just interesting to see that double standard. Now, it continues to get worse because not only are employers feeling it, and this isn't a problem that's unique to Indiana, you're seeing this trend throughout the country. And so what do we do to combat it? And how can we combat it when pharmaceutical companies are so powerful and so underregulated that they can work with doctors to encourage them to overprescribe these drugs?
Pot. I mean, you just brought it up, but obviously the cost, because it hasn't been capitalized by the pharmaceutical industries, makes it very accessible. Also, I think another part of the story, which is not incorporated in some of these articles, is that the conditions of the 9-to-5 labor are extremely horrendous to the body. I know a lot of these opiate cases come from workers' comp insurance situations, so they might not be directly related to some of the harms of a 9-to-5 day where you're sitting in your chair. I think sitting in your chair is supposed to be
bad for your heart.
Yeah, and you have to get up every 45 minutes. So it's hard to have a collective study on the overall health effects of being at a 9-to-5, sitting down and being trapped on a desk. But I can probably assume that this maybe contributes to some of the issues that people are experiencing. I used to work in an office 9-to-5, and literally every person had at least 5 or 6 pills that they would take during lunch.
Wow.
And it was common. You know, they had.
Were they painkillers? Or see, that's the interesting thing to me, because before reading about this, if someone had asked me what types of drugs do you think people abuse in the workplace, I would think that they'd be stimulants like modafinil or Adderall, things like that. But it turns out that painkillers tend to be more of an issue. So what kind of drugs were they?
I mean, it was a collection of everything about the, just people getting older, obese, and I assume painkillers were tied into that. I didn't do an exhaustive study, but this is not surprising to me. Again, like you said, with pharmaceutical companies pushing on the medical industry, their products, with the zeal to sell to consumers, to customers. And this was actually the more shocking thing in the story to me, was that 45 people per day die from opiates. I mean, we don't have that number for
marijuana.
Marijuana, for vitamins, for anything else that could be turned to in terms of like the Eastern health industry, right? Instead of like the aspirin or the opiates. Yeah. But it's interesting, like you said, it's unregulated, it's rampant, but it's generally accepted into our lifestyles without any opposition.
Right, Margaret, wouldn't you argue that one of the reasons why it's so accepted is because of the fact that you have illicit drugs constantly, in the press, people fear-mongering about it in the press. But when it comes to prescription drugs, there's this like sense that it's legal, right? And if it's legal, it's harmless.
Legit,
yeah.
Right? We should ask Rush Limbaugh this question.
That's a good point. That's a good point.
I laugh about this, but honestly, opioid addiction dependence, it is so serious. It can kill you. Withdrawals from this can kill you. Oxy is such a major issue right now everywhere. I come from a state where people are really poor, and this type of dependence, hyper-dependence, it's so rampant where I am, and it makes me sick and sad at the same time. But we're not really dealing with the issue of dependence. Withdrawals from opioids can actually kill you as well. I mean, this is serious shit, and the fact that I don't know what the answer is. I don't think going after doctors is the right move. I think that maybe taking this out of the closet and
I think that the best thing to do is target pharmaceutical companies and the ties that they have with doctors. Look, I think that there are lots of really great doctors out there that remain principled, but there is a very close, friendly relationship among some doctors and pharmaceutical companies. There's also a very close relationship among pharmaceutical companies and the board that comes up with the diagnoses in the DSM, the Diagnostic Statistical Manual. These are all very corrupt issues that need to be addressed and need to be talked about, but oftentimes they're not, because who has the most power in this country? Those with the most money.
Right.
And pharmaceutical companies are obviously tremendously, fabulously wealthy, and they can get any type of regulation or deregulation passed that they want, as long as they buy the right politician. I want to leave you with one other statistic just to give you a broader sense of what's going on. I know I focused specifically on Indiana. A study published in the journal Pain Medicine found that prescription opioid abuse cost American employers more than $25 billion in 2009 alone. And that number is likely much higher now because the number of addictions has increased as well. And remember, this is about opioids. This doesn't even include heroin addiction, because as Margaret mentioned, you made a great point, a lot of people do get cut off from these painkillers because their doctors realize, oh wait, you have an addiction, maybe you should stop. And then they're so addicted and the withdrawals are so bad that they seek heroin on the black market.
Right, or the prescription runs out,
Exactly,
right?
exactly. So this is a huge issue. Our focus should shift away from marijuana and onto these prescription drugs that are being abused.